First, let me welcome everybody out tonight. My name is Phil Bondurant, and I have the... Closer? Is that better? Okay. Again, my name is Phil Bondurant, and I am the Director of the Summit County Health Department, and I have the honor tonight of kicking us off for this wonderful event. The speaker series is something that over the last 3 years has really kind of evolved into what we are here discussing tonight. We started out with the idea of how do we connect a changing climate and the impacts that it has on our health. And whether you're a firm believer in the idea of climate change or you're still a skeptic and want to learn more, tonight is the night where we can do that, and you're in the perfect place to have those conversations. I'm really excited about the opportunity to learn from three professionals on exactly how air quality or poor air quality impacts our health. Now, we all know if you walk outside and you can taste the air or there's a fire nearby, we know that's not good. We can tell that if you have asthma, it's hard to breathe. Or we know somebody that has asthma, they're struggling to breathe. But tonight we're going to learn why. We're going to learn the long-term impacts of that. We're going to learn how the environment influences that, how we're influenced by our environment around air quality. And it's an exciting opportunity to ask some of the tough questions that you might have. We have three experts here ranging in different disciplines that can absolutely provide you the answers that you're looking for to some of these questions. It's an exciting time. It's something that we've been looking forward to for a long time. And it's perfectly in line with some of the other topics we've covered. If you've been to any of the other speaker series events, you know we've covered mental health in our agricultural community, water availability, drought conditions. We've spoken with our high school students across the county about their feelings with the changing climate change, and what they fear most in their beloved Summit County, what it's going to look like in the next few years when they come back after attending to things that they prioritize. Are they going to have a home to come home to that looks the same way as it does today? We've had the opportunity to learn from individuals how we can be aware of what's happening around us and then take action to potentially influence that. So tonight, you're a part of our efforts to learn more about this changing information. The information is available to us, and I'm grateful for that. The last thing that I want to do and say is I want to give a shout out to our sustainability team, to our communications team, and the team that helps put these events together. They do not come easily. The topics that have been shared with us through the feedback is wide-ranging, it's diverse, it's informational, and honing that into a position where it can be beneficial for an hour-and-a-half conversation is not easy. So, Emily Quinton is the Director of Sustainability. She's in the back there. Emily, raise your hand. She is an absolute rock star and the reason that we are all here tonight. So if you can give her a round of applause. Those of us, Bailey here doing our communications, Megan and Nancy are also on our team. We have a few members that weren't able to make it tonight, but we benefit from Emblem's leadership and organization so that we can be here to learn tonight as well. So let's give them a round of applause as well. Great. Okay, Emily told me 5 minutes. I think I've done way over 5 minutes, but I apologize. My next job is to introduce my good friend, Alyssa Van Veen, who is also a Board of Health member and former chair of the Board of Health in Summit County. Alyssa's bio is up here, so I'm not going to take time to read that, but if there was ever a person that could facilitate a conversation around this, connecting public health and climate change together in a way that's understandable and digestible, it's Alyssa. So without further ado, Alyssa, the show is yours. Let's give her a round of applause, please.
Thank you. Hopefully I can live up to that. It's great to see so many of you here tonight, and I'm excited for this conversation, and I'm really happy to be here facilitating. To review a little bit of what we're going to go through tonight, see if I can get back to the agenda. We'll go through quick introductions, and then we have, as Phil mentioned, a series of presentations, and then we'd like to open it up for a panel discussion as well as a Q&A. So throughout the presentations tonight, I'm going to pull up, let's see, is the QR code, might be earlier. Nope. I'll have Bailey pull up the QR code while I explain it. So we do have an option that you can scan on your phone the QR code, and then you can submit a question at any point during the conversation tonight or during the presentations. We're also happy to have you raise your hand, and we'll pass the mic around when we get to that point as well. So before we get started, I did want to I'll give you a second to let everyone scan this, and then we can get into introductions. Okay. I'll start with Seth.
Okay.
And we'll pull this up again. I think it's on the slides before each speaker starts, so you'll have another chance to pull it up if you need to. So to start off, I'd like to introduce Seth Arns. Seth is a research scientist for the Western Water Assessment, where he conducts applied climate research to assist resource managers and local government with understanding and adapting to climate change. Previously, Seth worked as an environmental scientist for the Utah Division of Air Quality, where he conducted research on ozone pollution and maintained the state's air quality monitoring network. Seth has earned master's degrees from the University of Alaska Anchorage and University of Utah. And our second speaker will be Dr. Carrie Kelly. Dr. Kelly is a professional engineer and an associate professor of chemical engineering at the University of Utah. She's committed to the translation of science to data-driven policy decisions, and her research focuses on understanding and addressing air quality challenges, including using cost-effective air quality sensing to empower individuals and communities. Dr. Kelly has served 8 years on Utah's Air Quality Board and has received numerous awards, including UCARE's Air Quality Person of the Year. And our third speaker is Dr. Wing Province. Dr. Province is an emergency physician who practices at both Park City and Heber Valley hospitals. He's also the chief medical officer of Park City Hospital and teaches healthcare executives at the Intermountain Leadership Institute and the Healthcare Delivery Institute. He earned his undergraduate degree from BYU, an MBA from Harvard Business School, and completed his medical training at the Johns Hopkins School of Medicine. And he and his wife are the proud parents of 4 boys and 1 girl. So I'll turn it over to Seth to start us off with providing some additional information on air quality in Summit County and the possible changes in the future. Let's see. I think down gets you to the next.
Good evening. My name is Seth Arns, and I'll be talking to you tonight about the impacts of air quality and climate change on health here in Summit County. So we're going to be talking about these kind of combined overlapping impacts of climate change, air quality, and health. And to start off, I'm just going to give you a bit of an introduction to air quality. So there's 2 primary pollutants that impact air quality here in Summit County. The first of those is particulate matter. This comes in 2 sizes. They're essentially very small particles of dust. They're either sized of PM 2.5, that's 2.5 microns, so really small, or PM 10. In the summertime, there is periodic pollution from PM 10 and PM 2.5, and occasionally there can be slightly elevated concentrations of PM 2.5 during winter inversions. The second primary pollutant here in Summit County is ozone. So ozone is a colorless, odorless gas that is formed through chemical reactions in the atmosphere. The primary things that build ozone are emissions of nitrogen gases from things like tailpipes of cars, and then in the presence of strong sunlight, that reacts with these organic compounds in the atmosphere, volatile organic compounds. An example of this would be when you pump your gas and you get that smell of gas, that's benzene. So that's an example of one of these volatile organic compounds. There's also a natural source of these VOCs, especially here in Summit County. Trees emit VOCs. So when you're walking through a conifer forest, that lovely fresh scent of pine that you get, those are actually VOCs. And even though those are natural, those can help to form ozone. And kind of the third air quality problem is really the combined effect of particulate matter and ozone. We do have times here, especially in the summer, in the presence of wildfire smoke, where you can get elevated amounts of both particulate matter and ozone, and that can cause sort of these compounding health impacts. So first I wanted to just give a little bit of an overview of some specifics that we know about air quality here in Summit County. We don't know as much as we do, say, on the Wasatch Front. That's because the state hasn't monitored air quality on a consistent basis here in Summit County, because there haven't been the same kind of problems as there are down on the Wasatch Front. However, back in 2012, when I was working for the Division of Air Quality, I led a summer ozone study looking at ozone pollution along the Wasatch Back, and 6 of those sites happened to be in Summit County. Somewhat surprisingly, during 2012, all 6 of these sites and all of the sites along the Wasatch Back exceeded the EPA standard, the health standard for ozone. And it exceeded it on quite a few days, ranging from 5 days that exceeded the EPA standard here in Camas to a high of 23 days up on Parley Summit. In general, we saw the worst ozone pollution at sites closer to Salt Lake City. And also the ozone pollution, both the magnitude of it, how high it was, the sort of patterns during the day, the days we had high ozone, they kind of mirrored what we saw in Salt Lake County. And that was somewhat surprising to me, that the ozone problem, at least in 2012, was essentially just as bad here in Summit County as it was in Salt Lake County. And a lot of this does have to do with Salt Lake County. There's this massive urban source of pollution and emissions. And because of the weather we have here in the mountains, on a daily basis, some of that pollution gets transported up the Parley's corridor, over Parley's Summit, and down here into the basin around Park City in Summit County. I do want to put this in context that summer 2012 did have very high ozone. This was a bad ozone year. And part of that was influenced that it was also a bad wildfire year. It was very hot, very dry. The winter before was dry, and there was a lot of wildfire smoke in the area. And wildfire smoke, while in that smoke itself, there's not ozone in it, but some of those chemical compounds that form ozone, these VOCs, when trees get burned, some of those VOCs are present in that air mass with wildfire smoke. So all these factors can kind of combine, even in a relatively rural place where there's not these very large local sources for emission, you can have this ozone air pollution problem. And this is an example of a compound air quality hazard. What I mean by that is that there's 2 air quality problems co-occurring at the same time, both high particulate matter and high ozone. And that's influenced from the urban air mass that comes up from Salt Lake City. And this is important because ultimately we care about human health. And both of those pollutants have health impacts, but the combined impacts can be even greater because both ozone and particulate matter affect the human body and human health slightly differently. So I just want to talk a little bit about, this was some old work. This was almost 15 years ago. So what do we know about what's been happening over the last couple years? Well, unfortunately, I was hoping to give you a really clear picture of this, but we don't have a really clear picture. The state doesn't monitor air quality up here. Summit County has been monitoring air quality, but they're not a dedicated staff like the Division of Air Quality is. So there are some limitations to the data that they've collected. One thing I can say is last year, in 2024, the Division of Air Quality did install a monitoring site in Heber. So while that's outside of Summit County, there's a lot of similarities between the air quality issues in Heber Valley as there are here in Park City in the Snyderville Basin. And during 2024, there was 1 day that exceeded the EPA standard for ozone in Heber. At a quick glance of some of the data that Summit County Health Department shared with me, I didn't find any of these same high ozone episodes like we saw in 2012. That said, it doesn't convince me that there's not a problem. There were a lot of gaps in these data. There were some years where there were problems with instruments, or some years where certain data wasn't collected, and there weren't as many sites as I monitored in 2012. There were some years like 2014 and 2023 where I did see no high ozone days. Now, thinking about the other pollutant we care about, particulate matter, One thing that is good is there's not an emerging problem of particulate matter during winter. Down on the Wasatch Front, there can be very bad air quality problems during winter with temperature inversions, and then the complex chemistry in that atmosphere can form this small particulate matter, PM 2.5. We're not seeing that in any of the data that I saw up here from the Park City area, which is good. However, there were periodic episodes of elevated particulate matter during summer. Almost all of these are very likely associated with wildfire smoke events. One in particular from this summer, there was elevated particulate matter on July 23rd through 24th, and this almost certainly came from a wildfire in northern Arizona. The image on the right here shows the smoke plume around that time period extending from northern Arizona across the eastern half of Utah and then on east across the U.S. So I want to leave with just a few comments about these data. I would say there's still some uncertainty for me in the data that I've looked at on what the status of ozone air quality here in the summer is. And the big reason for that is just there hasn't been consistent widespread monitoring of ozone since the work that I did well over a decade ago. And also that we are seeing some of these compound air quality hazards. On some of these high wildfire smoke days, there very likely may be high ozone on some of these days. So this is a concern that should be considered in the future. So now I want to switch and just talk a little bit about how a changing climate might be impacting Summit County. When we think about changes in climate, the first thing I think about is temperature. Well, we've seen historical temperature increase here in Summit County over the longer term records that they are, maybe going back about 70 years. Temperatures will continue to increase in the future throughout the 21st century. Second thing I think about with climate change is precipitation. Well, we've seen no change in precipitation over the last 70 years. There's kind of just variability from year to year, which is a normal pattern that we'd see. In the future, there may be a slight increase in precipitation. One thing we know for certain is that there will be less snow and more rain. Now, these two facts about temperature and precipitation don't in and of themselves impact air quality, but they impact weather events such as natural hazards that do impact air quality. So we've seen an increase in drought in the western United States, not so much here in Summit County, but in the Four Corners area of the Southwest. That region has been not just in a drought, but in a mega drought. There's been drought for the last 25 years in that region. We're likely to see increases in drought in the future. Wildfire has also increased over the last 40 years in the West. Looking at the acres burned per year across the West, there's been a 135% increase in the area burned by wildfire since the mid-1980s. We've also seen an increase in extreme heat. What I mean by that are these days that are very hot, greater than 90, 95, 100 degrees. We'll continue to see that in the future. Now, just to give you just one bit of information about the changes that we have observed, this graph here shows average annual temperature from 1956 to 2024 from Wanship Dam, so just down the road a little bit. And if you look at it, it kind of looks like temperature's increasing. And in fact, if you look at two time periods, the first 30 years to the second 30 years of this record, there's been about a 2.5 degree temperature increase over the last 70 years here in Summit County. So the change that I've shown historically and that we're most certain about in the future is temperature. Well, why do we care about that when it comes to air quality? Why does just a few degrees matter? And on a daily basis, whether it's 88 or 86 degrees, maybe doesn't mean that much. But if you're talking about average annual temperatures, 2 degrees means a lot and can have a big impact on various weather and climate processes. Increased temperature causes drying across the landscape. That drying will increase drought. So how frequently we see drought, how severe that drought is, and how large of an area the drought covers. When there's more drought, there's a greater risk for wildfire. More drought doesn't mean there will be more wildfire. It just means that it creates conditions that there's most likely to be more wildfires, and these wildfires will be larger and more frequent. With more wildfires, we'll see more wildfire smoke, and that will degrade air quality. So what will the climate look like 30 years from now? Well, we'll likely see a 2 to 3 degree temperature increase by 2055. Precipitation, we may see a slight increase in precipitation, but not much of a change. The biggest changes will be related to temperature and changes in snow. Now, thinking about how these impact some of the weather phenomenon that impact air quality, wildfire, we are likely to see an increase of about 50% in the number of extreme fire risk days by mid-century. So these are days that are extremely hot, dry, and windy. We might see these from the Weather Service as red flag warning days. Drought will become more frequent and more severe. Wildfires will get larger and more frequent. Scientific studies looking into changes in wildfire project that there will be 175 to 600% increase in the area burned by wildfire on a yearly basis by the end of the century. So this will likely mean that there will be more days with poor summer air quality due to wildfire smoke. So now, thinking about how air quality and climate change intersect, the two things that concern me are drought and wildfire. Drought in and of itself doesn't cause air quality problems, but it leads to conditions where wildfires will more likely burn. In the future, temperature increases will increase the severity and frequency of drought. And it's important to note that even if we see, usually we think of drought as a lack of precipitation. However, when thinking about the future, we could have the same amount of precipitation, and if temperatures are 3 degrees warmer, 5 degrees warmer in a given summer, we will see more drought, even if we have average precipitation. Now, wildfire for me is the number one concern on this intersection between air quality and changes in climate. We're going to see a longer fire season in the future. That means there's more days where a wildfire could start, greater length of time where populations may be exposed to wildfire smoke. This longer fire season is because the snow-covered season is going to get shorter. Snowpack on average will start accumulating later, melt out sooner. That means landscapes will dry out sooner, and there'll be a longer period of time in which there's conditions where fires are likely to burn. Again, there'll be larger, more frequent fires. And I want to stress that this is not thinking about air quality and health impacts from wildfire. It's not just local fires that are going to impact that air quality. It's really any fires in the west, downwind of us, when the wind happens to blow from the fire to here. So it's not just what happens here, it's what happens downwind. And then finally, just to kind of tee things up for the talks that come next about, more specifically about health, we really care about this intersection of health, climate change, and air quality. With increases in wildfire, that means we're going to increase the number of days with wildfire smoke. This increases exposure of human populations to this air quality risk. And these cause health impacts. Just in a general sense, particulate matter has both cardiovascular and pulmonary impacts. It can impact both our heart and our lungs. We also have to be concerned about sensitive populations, those who are young, old, pre-existing medical conditions that may that these poor air quality days will have a stronger impact. There's also the issue of ozone. With more wildfire smoke days, there's also likely going to be more high ozone days. And then you have to think about these compounding impacts of both particulate matter and smoke. And then finally, there is a third compounding factor that can impact human health, and that's heat. Likely, on days that we have wildfire smoke, it's probably going to be hot and sunny. And very hot days also have a negative impact on human health. Historically, it's not that hot up here in Summit County. Looking at historical data, there was only about 1 day a year that exceeds 90 degrees in Park City. I know that's not the case now, but we're 20 years past where this data goes. In the future, by the mid-2050s, there's projected to be 10 to 14 days that exceed 90 degrees, 2 to 3 days that exceed 95 degrees. Again, thinking about variable exposure of different people, residents without air conditioning or working outdoors will have higher exposure to both these heat and air quality impacts. And I'll just leave you with a wild card in this problem is what happens down in Salt Lake City. The influence, one of the big reasons why there can be an ozone problem here is the fact that there's an ozone problem in Salt Lake, and that air pollution gets transported up to this area on a daily basis. So in some ways, what happens in Salt Lake County is going to happen here. So whether air quality stays the same, improves, or gets worse in Salt Lake County will impact air quality here. Thank you.
Hi, I'm Carrie Kelly from the University of Utah, and I'm going to build a little bit on what Seth talked about, and I'm going to talk about exposure to poor air quality, some things you can do about it, technology, and some emerging research. Okay, so how are we exposed to poor air quality? So outdoors, we have to think about how we can manage that. Some of the ways we're exposed are when we're working outside, especially exercising outside, enjoying the outdoors. This is a great place to enjoy the outdoors. We do have to be mindful of poor air quality, especially for youth, because they've got developing lungs and respiratory systems. And when you're exercising or working vigorously, you're going to breathe really deeply. You're going to intake more pollution. You can have greater health effects. It also, interestingly, decreases athletic performance, which can last for several days. Also, indoors, this is a really under-considered source of poor air quality exposure. We spend about 80% of our time indoors, and typically air quality is worse indoors than outdoors, so it's something to think about. And I'm going to talk a little bit about how technology might help understand these things and help people reduce their exposure. So I'm going to give you a couple examples here. This is the Yellow Lake fire from last year, right about a year ago. And I'm going to show you some examples of how a fire close to you can have a big effect on local air quality, and those effects can change drastically over short distances and over short time frames. So if you look at these dots, these show particulate matter, PM2.5 levels at various locations around here. This includes data from the Utah Division of Air Quality, from Purple Air, from TELUS and the University of Utah. We placed a sensor at Manila High School. We have a project from the National Science Foundation to get air quality sensors on high school athletic fields. And this sensor showed unhealthy for sensitive groups to sort of merging to unhealthy. And we were like, oh, well, there's no other sensor out there. Is there a spider in there? Is that measurement real? And it's the only sensor in that airshed, and there's only 1,000 people that live in that county. But when you looked at the wind, it showed you that the wind was pushing the smoke from the Yellow Lake fire right over Manila High School. So without that sensor, the high school would have had trouble knowing what their air quality was. The people making decisions about youth outdoor activities wouldn't have had that information. So we were delighted to be able to give them that information. Okay, so 2 days later, I guess 3 days later, on the morning of October 14th, we saw this happen. You can see air quality changed quite a bit. So Manila looks good. Now Tabiona, Park City High School, into Summit County, and even north into Ogden, Layton, North Salt Lake, air quality deteriorated. So the wind shifted direction, and you can also see some interesting things here. So you've got a close proximity wildfire. And you can see the difference between Tabiona and Duchesne. You've got a pretty big difference in air quality over a relatively short distance. So that's where these low-cost air quality sensors can really help complement some of the regulatory monitors. The regulatory monitors put out by the state are great, but they're expensive, and you can only afford to have so many of them. Hang on, how do I get out of this? Okay, and now I'm just going to switch gears and talk a little bit. So for some of the big outdoor air quality events, we have to think about how we can manage our exposure. But if you're thinking about indoor, you can not only manage your exposure, but it's a lot easier to get at the source. So we spend 80% of our time indoors. This is a little study we conducted at the University of Utah, and our facilities was awesome. We put air standard for outdoor air for about 5 or 6 hours during this event. And then WHO has a standard or a guideline of 15 micrograms per cubic meter. And indoors, which is the blue line, we're exceeding PM 2.5 levels by quite a bit. And then we see these really interesting spikes, and we're like, oh, I wonder what's happening. Let's talk to facilities. It turns out the building where this happened, and we actually have several buildings that have this, what's called an air side economizer. An air side economizer is an awesome energy efficiency measure. It is a device that allows you, when conditions are good outside in terms of temperature and relative humidity, you bring in more outdoor air, you spend less on cooling. So when temperatures are between about 50 and 70 outside, low relative humidity, bring in more outdoor air, saves energy, awesome. The problem is when you're changing all these flows, you can bring in a lot of wildfire smoke pollution or other types of pollution. So we're working with facilities to manage indoor air quality during wildfire smoke events. And in fact, ASHRAE, the Society of HVAC Professionals, is recommending that all civic buildings have wildfire smoke management plans. And if you haven't taken measurements, then you wouldn't ever know that something like this is happening. So these types of measurements, they're not that expensive. They can give you an idea that something is going on that you wouldn't have known otherwise. We also looked at indoor air quality during different types of pollution events, and we saw that wildfires were by far the most concerning. During inversions in Salt Lake, we saw some elevated levels. Dust events, our filters did a pretty good job. We didn't see much increase. And in general, I don't want to diss on the University of Utah. Air quality is generally pretty good inside classrooms, but there is room for improvement. And this is a good example for what you can find, and that this is a pretty addressable problem. All you need to do is mitigate how you're using your dampers on your HVAC system. So a little bit about emerging research. So we're trying to help decision makers understand, okay, this is for outdoor air, how you should be managing outdoor activities, especially for youth. Okay, so this map shows all the counties in Utah. All the counties with colors show the average number of unhealthy days, and this is measured by the regulatory monitors. And then all those gray counties, no state monitor. Wasatch County has changed. They now have Heber's got a state monitor, and that's relatively new, which is great, and that's that little green dot. But all those other gray counties don't get a forecast, so it's really hard to figure out what you should be doing in terms of, like, should your cross-country team be running? So you just don't know, and how do you plan what you should be doing tomorrow? So we installed monitors that are good at measuring PM 2.5 and dust in 7 counties that previously had no regulatory measurements. And then we also worked with atmospheric scientists to provide automated air quality forecasts for all counties in Utah, and that included 16 counties that did not have them before. And we are currently working with the Board of Education, the Athletic Trainers Association, High School Activities Association, and the PTA to develop actionable uniform guidelines. They actually have actionable uniform guidelines, but they're optional, and every district can do their own thing. And if your district decides that it doesn't want to participate because air quality is too bad, but the other district says we don't really care, then maybe you forfeit. So we want to work to make an even playing field that protects youth. So that's a little bit about what we're doing there. We have a new project working on improving indoor air quality and energy efficiency in schools. So how you manage your HVAC system is really linked to indoor air quality. And if you've ever been in a meeting and you're really bored and you feel like you're going to fall asleep, it might not be that your speaker is that boring. It might be that CO2 levels are too high. This is not actually dangerous, but it does inhibit learning and it makes you sleepy. But it is something, again, that is pretty easy to mitigate. So if you bring in more outdoor air. So we've got a new EPA project where we're looking at indoor air quality, including CO2 and radon in schools to help protect children in schools. And I wanted to acknowledge all the people that help make this work possible. The National Science Foundation, we've received several awards from them to help get this going. The US EPA has helped us with the new project in schools. The University of Utah and facilities has been great. Purple Air, who's here today, generously shares their data. The Utah Division of Air Quality, also here today. They allow co-location with their regulatory monitors. That helps us get good quality data. And then TELUS, we've got TELUS sensors. I think that they're going to be here today, and they have helped us as well. So we appreciate all the help. And UCare's here too, just to give them a shout out. And do-it-yourself HVAC filters are very good. I see they're back there. So I'll take advantage of talking to all those folks. And then thanks to all the teams. I do some of this work, but most of this are my excellent students and collaborators, and I wanted to thank all them. So thank you very much, and I will turn it over to Dr. Province. Oh, sorry, one more thing. Sorry, if you want to access this, that you can get air quality forecasts and current conditions at AQ and U. So that's a new thing we think is really important. And then there's some other places. If you want to see the slides, you can contact me. Sorry, now I turn it over to you.
Oh, that's great. Thank you.
Thanks.
Thank you to Carrie and Seth. I learned a lot from that. A lot of stuff that I didn't know that I think will help me even in my practice. So my name is Wayne. I'm an emergency physician. I work in Park City and Healers in there. And mostly work overnights. But sometimes I work during the days, but I'm also the chief medical officer over at Park City Hospital. Just a curiosity, who here has asthma or COPD? Raise your hand. Okay, how many of you know somebody with asthma or COPD? Raise your hand. Keep your hands up if you have those, or if you know somebody with lung cancer, bladder cancer, or leukemia of any kind. Keep those up. Okay, so you know what Carrie and Seth just talked about impacts directly those of us who have those kinds of conditions or know anybody with those conditions. What I see in the emergency department when the pollution is high, and in particular I'd say in the summertime, as we learned that it's in the summer that we really have high particulate levels here in the air, we see a couple of different conditions. One, asthma exacerbations or COPD exacerbations. People come into the emergency department having an asthma attack or a COPD exacerbation. I thought I'd explain a little bit why. You don't really have to get so much caught up in the sizes and the numbers there, but essentially what you can think about is these air particulates are very irritating when we breathe. And so some of the smaller ones can make their way all the way down to the bottom to the alveoli, and that's where you get asthma or COPD exacerbations, whereas some of the larger ones can inflame and irritate just your nose and your airway, your upper airway, which can cause a lot of coughing. For those of us who have asthma or COPD, it can impact all of that, and that can lead to, as I mentioned, asthma or COPD exacerbation, which oftentimes brings people into the emergency department where we have to give them emergency breathing treatments. Sometimes they can't breathe on their own, and we have to put a breathing tube in them to help their immune system calm down so that they can get back how they were before. So this is how it impacts the body in the acute level. And this is in particular those days that you saw that were where the pollution was high. The question that I always get asked is, when should I stay in or when should I go outside? So I remember when I moved here to Utah, I moved here about 10 years ago, and at the time we had a little baby, and I remember we moved in the 3rd of July, and it was one of those rare days where it was in the 90s outside. Inside my home, the thermostat set at, I think, 99, 98 degrees, so it was pretty hot. We called our landlord and said, hey, your air conditioning is blowing out kind of lukewarm air. I think it's broken. And he said, oh, I'm so sorry. Let me get someone out to fix that for you. I said, yeah, we got a baby who's turning bright red, and it's an issue for us. He said, it's going to be tough. Tomorrow's the 4th of July, but I'll see what I can do. Send someone out, and this angel of a man came and saved the day, and then told us, well, I've got good news and bad news. The good news is your heater works. The bad news is that you don't have air conditioning in your house. And I spent all my life in the Midwest where everybody has air conditioning units and a window unit, and then I moved here from Maryland. And this is the first that I've ever been anywhere where there wasn't air conditioning. And I said, yeah, well, there's only a handful of days that it gets over 90 degrees, so most people don't even put air conditioning in their homes. As I think about this, and I think about how many people are like my family in those situations where you open the windows at night to stay cool, or open them, throughout a lot of the day until it gets really too hot. And you think about the air pollution quality, or the quality of the air and the air pollutants that are out there. Some days it gets into this red range, and if you're exposed to it all the time, it's going to be really impossible for you to stay out of the hospital if you have some of these conditions. And so, This is some of the short-term implications you have to think about. Long-term, though, I mentioned some cancers. Lung, bladder, skin, and some of the blood cancers can be caused by a lot of those air pollutants. And so there's not only short-term but long-term consequences to the quality of the air or the bad quality of the air. And so as a physician, what I would love to see in partnering with public health and with some of the partners that Carrie mentioned that are here, I have kids that are in all different age groups, and we're always so attentive to the weather outside and whether or not it's going to rain, whether there's going to be a storm, canceling practices. I would love for the school districts in Summit and Wasatch counties to start paying attention to the air quality. And as I learned from my colleagues here, we may not have access to that data readily. I would love to see a collaboration with public health to be able to provide this information to those who are making those kinds of decisions. I think it's helpful for our children, but I think it's also helpful for those of us who may be thinking about going out for a bike ride, or those of us who maybe aren't doing it for recreation, but who work outside. I think a lot of I grew up in Indiana in a very small town. All my friends and family are farmers, and so I think about those kinds of folks here. I also think a lot about the immigrant population who primarily work outside, who also have a lot of asthma and COPD, and the threat to their short-term and long-term health. So I think there's a lot of opportunities. My goal is to keep people out of the hospital and keep them healthy. And I've learned a lot. I think there's a lot of opportunities where we can take what Seth and Carrie taught us and incorporate it to improve the quality of life for all of us here in the Wasatch Valley. That's all I got.
Currently, in terms of at the federal level, Summit County doesn't meet the population criteria to be under the designation of their monitoring. Hopefully I'm saying that right. But currently, if you look at this map, it's showing which counties are meeting attainment, are the white counties, the white areas, and those are meeting the air quality standards under the national ambient air quality standards. And so there's no requirement in those counties for air monitoring or emissions programs. So that's where Summit County is currently. But looking to the future, when the county population surpasses 50,000 per census data, I think the last census we were around 42,000, and I think the last estimate I saw was about 44,000. As we know, there's a lot of growth, and with growth comes more concern about air quality, and we may well face some of those other programs, such as emissions programs, that required monitoring. Summit County currently is doing some monitoring. As they mentioned, we have Purple Air monitors throughout the county, and those are accessible through the Purple Air website. The health department also has a aeroqual monitor that measures ozone as well as PM 2.5. I think that's what Seth was looking at for some of the data. But that's not a state monitor. It doesn't count as the official regulatory monitors, if I'm using that term right. We also have, the state is in the process of installing one of the certified and licensed air monitors in Summit County. So again, thinking back to Dr. Kelly's map of the gray counties, it looks like at some point we will be online to have one of those monitors and have more information there as well. So the health department also really looks for opportunities to promote air quality through information sharing, setting policy, and engaging in local initiatives. So for example, the health department has worked with the community development department on code amendments. These include prohibiting wood burning appliances in the Snyderville Basin in new construction. Also includes requiring EV charging infrastructure and bike parking in new construction. We haven't talked a lot about it tonight, but in Summit County, given the geography here, radon is also an air quality issue of concern, and the Environmental Health Division has done a lot of work there to partner with schools and other people in the county to test buildings for radon. They also have low-cost home radon tests available for the public to use. Those can be picked up at the health department. I think they're $10. And one of the things they've done that I've found really helpful as a resident is they've created a map where you can actually go in and see what the radon testing is coming back at for different areas of the county and what the neighborhoods look like. And then also communication. So the health department, as Dr. Province was talking about, plays an important role in communicating to the community when we're in a situation where the air quality is at a level that may have hazardous effects. So the health department's goal is to make sound information available to the necessary personnel to enable them to make the decisions. So for example, getting information to the school districts so the athletic directors and others can make decisions about sports practices, or to the community partners that are doing youth sports and other activities outside. Currently, these alerts are sent out via social media, employee outreach, media, as well as website updates. We also do have, the health department has an option that you can sign up by texting SC Health to 91896 to get those alerts sent directly to your phone. I think that's a work in progress as they're starting to use that more and more. Also, Instagram, Facebook are good places to follow. And with that, I think that wraps up the presentations. So we'll move into, let me find the opportunity drawing, but I'm looking for the QR code. So I'll put this up while we do the opportunity drawing and give folks a chance to start submitting questions that way.